Call the meeting to order. Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Mr. Jack W. Bulge,
Present.
Mr. Kevin Hom,
Present.
Mr. Al Weisel,
Present.
Mr. Craig Steckler.
Present.
Any comments on the minutes from last meeting? A motion to approve?
I move.
Second.
I wasn't here.
Okay, second. All those approve? Aye.
Abstain.
Okay. Do we have any oral or written communication?
There were no written or oral communications at this time.
Okay. We'll wait for, yeah,
Okay, let's hope he's,
Ray, would you like to? With his bad knee, he might not make it before the meeting's over.
okay, so we'll do the garage status.
Let's go with the garage first. This one is easy because the garage is finished now. It finished, as you see over on this page, but it finished around, I believe it was $500,000 under the budget. So we had savings from the contingency that left over. At this point, the work is being completed. Punch list work is being completed, and we're working with Bart to move ahead with the tenant improvements that they're having done, or we're managing for them on the Bart building itself. But as Ed was saying earlier, the garage was occupied and it's completed at this point. So unless you have other questions on that, that's kind of the overview of the project.
Just a comment. We went over budget. We just didn't go over budget so much we used up all the contingency.
Well, however you want to look at it. We
That's how
we
I
have
look
money
at it.
left over out of the
Okay.
total budget.
Okay.
Few $100,000.
When you say it's over, does that include the punch list is done also?
Yeah, I mean, the cost of the job is settled. The punch list is to be finished within the contract amount.
Just to clarify, there's no outstanding questions or differences with the contractor over that cost?
No, there's not, at this point, any claims, disputes, or anything like that.
Okay.
And it's just a matter of closing out on the remaining miscellaneous work.
Thank you.
And
Much
we
less.
have finished our negotiation, so we don't anticipate anything. These are the final, as we get there, you'll see the final numbers that we anticipate. We won't have a final closeout till the next meeting because there's just a few odds and ends coming in, but you'll see where we expect to end up.
Well, in spite of my comment, I think you did a great job.
And I think it's a great-looking building. You know, when you look at that out there next to the new building, it's going to look very nice when it's all put together. Okay, shall we move on to the pavilion? My presentation can be very brief tonight because it's all good news. If you look up there at the elapsed time and the percent earned, they're exactly the same, 44% as of the end of August. That's our reporting period. And the change orders, which have been submitted, which are included in the contract, are running pretty light overall. And the change orders that the owner is funding outside of the owner contractor's GMP, the $3.5 million we see up on the right, lower right, are those projects that we had planned to proceed with if funds were available, and we are proceeding now with the design is being completed, and we'll be moving ahead with those under the contract as change orders. So things are looking good on the financial side and the schedule side. I think the contractor is within about 6 days of being exactly on schedule, which is kind of the normal variance you get on a job like this. And as you could see out on the work, everything is moving along quite well on the site. The other sort of good news with regard to the project is that there have been no lost time accidents at this point. As we reported, we are under an OSIP, Owner's Controlled Insurance Program, and that is going very well also. And though you can't predict where you're going to end up until your loss rates are in after the job's over, the fact that you've got 600 days now with no lost time accidents is a real positive.
The only comment I would make in addition to what Ray said is that the $3.5 million that we're showing in change orders were changes that we had anticipated ahead of time, parts of the job that the scope was included in the job, but the plans were going to be changing because we had identified a few things that we weren't happy with or we wanted extended, in particular the connections between the main hospital and that building. So we set aside $3.5 million, and we're going, as Ray says, design's done, and we'll get bids on that. So that's not really change per se. I would say that we should anticipate by the next meeting to start to get our first change orders that are for the job. In other words, we've gone this far, and we've had very few things that have been submitted. But looking at pending lists and things that are now in discussion, I anticipate we'll start to have some coming through on the job. So the change order work so far, I mean, it's been almost nothing. So it's been a very positive thing so far.
Ray, any more comments? Any more comments?
No, that's it. As I said, I think it's all good news. The project is going very well. Unless we get really bad weather, we're almost past the point where that's going to be a factor in the construction and slowing it down. So everything's going very well.
Okay, should we go back? Bob, you want to come on up and we can cover the schedule and the cash flow issues? First, we'll do the garage.
As you're probably well aware, the garage physically finished for use in early August. Started using the garage in August. For first batch of people in there were the employees, followed by the general contractor, and we had them segregated. First 3 floors is for Washington Hospital personnel. Top 3 floors is construction. Nobody on the roof where the helipad is. And that's been going well. Few minor incidents, as you might well expect. Everybody a little bit guilty of driving too fast in the garage, and who doesn't? And exiting at premium times, people are always trying to get out of there quickly, but it's, I think between the hospital and general contractor and ourselves, and especially the hospital security, have got a real good handle on it, and we've policed it and gotten ahead of the game on all that. So it's been, I think, more of a good experience than a bad experience. Did anybody have any particular questions on the garage?
No, thank you.
Okay. On the money side of it, the monthly cash flow, as everybody knows, the job finished a few months late for occupancy. So the red spike at the end is the final billing from the contractor. The majority of those funds are retention funds that are being held till we have all the finished documentation in hand, and we're satisfied that we have it all. So we've released no retention. It's about $1.9 million. And there's our cumulative curve planned, which is the blue, and the red, which is the actual. Schedule-wise, I know you just took a tour. You got a good hands-on look at it. The obviously upcoming things that we're aggressively pursuing is getting the building weather tight. It's in probably a couple weeks behind our target to have it is where we want it to be, but hopefully it will be done in November, probably the latter part than the early part. We've started our preliminary items that are not on the schedule. We've started our preliminary commissioning with the project, with the MEP, and the commissioning agents are on the job periodically each month. They were there all day today. That is our next main focus, is kicking all that equipment and making sure it runs and testing it, and it's an ongoing process, as most of you can well imagine. The good news is the bulk of the equipment that's going to run that building is in the central plant. Most of the stuff that's in our building is distribution, but there is major electrical gear in there and things of that nature in air handlers. But we anticipate that to go well. As Ray mentioned, the rest of the job is within a few days of being right on target, which means that we would have early completion effectively in early 2017, substantial completion in June, and occupancy in August of 2018. Yes.
Okay.
Okay.
Any other comments on the cash flow? Are we all okay?
I think everybody's pleased with the process, the cash flow and the payment process. The hospital is very proactive, and as Jack Balch knows, if you want to have a happy contractor, you pay him what he's owed, and you pay him on time. And the hospital's doing that. It goes a long way. Unsolicited comment. Any questions?
No, thank you very much.
You're welcome. Thank you.
New Chris?
The new Chris. All right, so let's start with the parking garage project funding. As we've got the $23.2 million project budget. As of the last time that we met here in May, $20.7 million have been expended. Expenditures in this current period ran about $1.7 million, bringing total expenditures to $22.4 million. Total expenditures reimbursed with general obligation bonds totaled $21.8 million. All right, moving into the project cost to completion estimate. Total expenditures again at $22.4 million to date, an estimated $190,000 to complete, bringing in an estimated cost to complete of about $22.6 million, estimating right now at about $540,000 under budget.
Good.
And then looking at the Morris Hyman project, project budget sitting at about $346 million. Expenditures through May were at $109.6 million. Expenditures through this current period as of August 31st were at $48.3 million, bringing total expenditures to about $158 million through August 31st. Total expenditures reimbursed with general obligation bonds totaling about $152.4 million. And looking at the cost of completion on the pavilion, total expenditures again staying at about $158 million, estimated to complete it at about $182.1 million, giving us an estimated cost of completion of $340.1 million. At this time, that would be about $6.4 million under the budget. And as we keep going through the project, these numbers will keep being refined and reconciled, and so that's where that stands as of August 31st.
So our projections have actually improved in the last quarter in terms of where we are and where we think we're going to come in.
All right, then if we could look at the funding sources and cost to complete. General obligation bonds totaling about $311.3 million. Expenditures to date for the parking garage in Phase 2, expenditures of about $174.3 million, leaving us funds available from general obligation bonds of about $137.7 million. Additional funding sources as revenue bonds and funds from the Washington Hospital Healthcare Foundation, totaling $9.3 million, giving us total available about $147 million. Estimated cost of completion, as we spoke of, coming in at about $150.1 million, leaving us about $3 million to be funded through Washington Hospital reserves. Again, just of note, the $32.1 million you see there as an add-back amount, it's not reimbursable by GO bonds, is really for the equipment for the building.
So again, we saw an improvement. You want to talk about what it the $3 million bucks. I might remind you, when we started, we had this projected at $10 million. So things have improved over time, and even since the last quarter, if you want to.
Yeah, I think we were at $3,700,000 as of May. So at August 31st, we brought that down to $3 million. Things.
Well, one of the big credits we got for this quarter, believe it or not, was for parking. There was an amount in their budget for parking, and as soon as the garage got done, they no longer needed to utilize that. So we got a credit of about $600,000 just from parking, for parking, because the garage is on site for them. So that was the big one for the quarter.
Just some clarification. The revenue from the interest that you're earning from the unused,
Yes.
the funds that you've already generated, does that go to the general fund, or does it stay in the bond fund?
I'll let Dan answer that.
Yeah, that revenue stays within the bond funds. That's restricted to these projects. So as you can see, we're counting that as part of the overall funding.
So was that budgeted count originally, or is that what's also helping with the contribution of the general fund?
Yeah, well, that's a good question. We did not budget for interest to be self-funding, sort of. So no, we didn't budget for that.
So that's helping out.
It is. It is.
So some people call it arbitrage, but I don't.
That's right. So anyway, Jen, headed in the right direction there at $3 million.
Absolutely.
Yep.
Now, this does assume that all the contingency was originally allocated. That $6 million bucks, I think that's already been allocated out.
When
we
you say,
have
let's go back to so it's sitting in there, the contingency is sitting there, and it's, at this point, we're presuming that we're gonna only spend $343,000 of it.
I saw that.
Okay, so, yeah, so,
Correct.
And that does not assume that we're going to use up that's what I'm saying. the
yes, yeah,
Okay.
that's presuming we're not gonna spend that.
All right.
And then we have that, in case we have some disaster that occurs or unforeseen circumstance.
Okay.
Those are the numbers for today.
Okay.
Any other comments?
No, not this time.
Any questions? Okay. We have this that I'm not quite sure, the meeting topics for 2017.
Yes, we have the meeting times that should be in your binder, but our next scheduled meeting is for January 18th,
January 18th, yeah.
so 3 months from now. And
That's on a weekday, Wednesday, I would assume?
Wednesday is correct, yes.
Okay.
Happy New Year.
Thank you.
Well, if nothing else, meeting's adjourned.